Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help athletes and active people like you feel, look, and perform your best, regardless of age or injury. Thank you for joining us. Again, it is that one time, one place that I answer medical questions, orthopedic questions, injury, surgery, rehab, recovery, health and wellness, if that's the nature of your question. I don't do it in emails. I don't do it in comments on YouTube or anywhere else. This is the one chance, and we're doing it early this month because next week I'll be out for the Thanksgiving holiday. Those of you in America, at least, that celebrate Thanksgiving. If you're not in the United States, I apologize, but it's a holiday weekend for us, so very excited about that. As I get to your questions, please remember I am not giving you medical advice. I can't do that, and nobody can legally do that online. I haven't seen you, I haven't examined you, I haven't looked at x-rays or MRIs, so this is meant for general information and educational purposes only. It's aimed to help you translate what you've heard from your doctor so that it makes more sense, because so many people, they don't understand why they were told one thing, or there was a bunch of fancy big words that they just didn't understand. Or it'll help you ask questions when you do go to see an orthopedic surgeon. But I am not telling you what to do. I am not giving you medical advice in these answers. Also, I'll stay as long as there are questions. Sometimes that's 20 or 30 minutes. Sometimes that's 5 or 10 minutes. So we'll just see how that goes. And we'll start with Anna Marie because these were here before I even started today. So let's see what we got. My situation is I've developed a bone lump mid-tibia after rod surgery 6 weeks ago. Surgeon said can return to gymnastics eventually, 43, in my career teaching yoga. Kneeling, cat stretch. I'm curious about bone shaving treatments, osteotomy, if physio would help. The lump is stopping. What I suspect, and again, it's hard for me, Anna Marie, without seeing the x-rays or being able to examine your leg. What I suspect happened is the rod held the tibia in place, the shin bone. I don't have a whole tibia, but if I did, it would be, going all down here. But then your body heals that tibia fracture, and it does that by laying down new bone. And sometimes, yes, you can feel a lump. A lot of bones, that wouldn't be a big deal, but the shin, the tibia, there's not muscle or fat usually over that area, so a lot of times you would feel a prominence. Over time that gradually gets better, but it's over a long period of time. There's not really, to be fair, easy surgeries. Any type of surgery to remove extra bone puts it at risk for fracture, and you potentially create a much worse situation than a bony prominence. And again, I don't know necessarily what, I'd have to see it, but if what I'm describing was a patient of mine, I wouldn't do any kind of surgery for that either, because I think the risks far outweigh the benefits for what that's worth. Let's see, Daniel Silvera. Surgery 3 years ago, have a plate and 3 screws attached to my 4th metacarpal bone. Is it possible to have it removed, get my hand back to normal, no metal in me? So that's a good question. So the 4th metacarpal, if you're looking at a hand, is this long bone, not the pinky finger long bone, but the one next to it under the ring finger. And if, depending on the nature of a fracture of that bone, it'd be right here. Sometimes you could do it with a pin that goes down the bone, but yes, very often it's a plate and screws. And yes, once the fracture heals, typically you can go back in and take the plate and screws out. No long-term ramifications yet. A surgeon might have a patient limit activities for a few weeks while the screw holes refill in with bone, but there wouldn't be really a huge risk to that long-term. The challenge would be it's another surgery. It's not something you can do in the office. So surgeons typically only do that when that plate and screws are causing enough trouble to make that worthwhile. But if that's the case with you, that can, again, sometimes be a good idea. Again, not medical advice, but that's not an uncommon thing. All right, R. Howell, doing some research. What brands of exosomes? So I just talk about exosomes. I don't say that I do or don't do them. As far as brands, I will leave that to the companies that do that. I don't have any financial interest in any of it. I don't promote specific brands of anything. So sorry about that if you were hoping that I'd say one versus another. Bambi Jacobs, physical therapy, decreased length of time. One will have a frozen shoulder. Seems to be making me have pain at night again. So yes and no. Frozen shoulder, adhesive capsulitis, the thought is if you did absolutely nothing, it will eventually go away, but that takes a long time, sometimes 6 months, but I've seen 12 to 18 months, so most people choose not to do that. Yes, physical therapy can speed that process up, basically helping you get the range of motion back, albeit you're having to stretch out that capsule, which is usually why that pain exists, but also to help people do what they want to do easier than they can with limited range of motion, and obviously pain when you try to get past those ranges of motion. Having said that, that's one of a number of treatments. That's usually the first line of treatment, but sometimes things like, and I'm not a cortisone fan for most things, but this might be one area you might think about doing it to just try to soften up that capsule so the physical therapy can break it up a little bit easier. If you're still not making progress, sometimes there's surgical procedures, whether that's a manipulation under anesthesia where you're sedated and then the surgeon basically moves your arm around to break up that capsule and get range of motion back, and then after that procedure you do a lot of physical therapy to keep it, or where the surgeon does what at least one way to do it would be an arthroscopic surgery where he or she cuts the capsule open to get range of motion back, and then again a lot of physical therapy for the patient afterwards to keep that range of motion. Most people do not get to the point they need a surgical procedure, but it can be tricky for those that do. It does get better, but it's a long process. I'm a big fan of physical therapy, so I generally, that's with my patients, that's typically where I start if I have a frozen shoulder. Lance, never seen a physio, 7 months after ACL. Can I just hit the gym without going to physio? I mean, I suppose so. I mean, I wouldn't have my patients do that. I feel like especially that is one of the surgeries that the success rates of getting back to the same level of sports and exercise at the same level or higher level is highly dependent on the rehab. It's not just range of motion, it's strength. It is being able to land like you were before, being able to push off the way you could before, the way you could plant your foot and change directions. And that's harder to get back just with time and seeing how it goes on your own, even going to the gym on your own. It's sport-specific rehab, and I'm a big fan of physical therapy, but at the end of the day, that's a patient's decision. If he or she doesn't want to do that, that's certainly up to them. If it was my patient or if it was my knee or a family member's knee, I would definitely recommend to them to go to a physical therapist, especially one that rehabs a lot of athletes. Anna Maria, again, yeah, I just addressed that, Anna Maria, about the bone shaving. I don't think that, I mean, maybe that's an option again because I can't see your x-ray, but at least if it's just the fracture healing, most surgeons would not go in and do that. Does PRP improve, preserve knee health? Have arthritis in the knee that causes occasional discomfort? Would PRP injections before arthritis gets bad help to preserve knee forestall? So that's a great question, and there is thought that would help, especially in early osteoarthritis changes. PRP has had good results in terms of, in fact, in some studies, better than other types of injections like cortisone shots or hyaluronic acid injections for patients with early to moderate osteoarthritis. How well it rebuilds the articular cartilage is where there's a lot of debate, and that's where the studies looking into exosomes, as somebody was asking earlier, or stem cells, the hope with those is maybe those regenerate cartilage. Osteoarthritis is basically a breaking down of the articular cartilage and the bone under that articular cartilage, so maybe those regenerate it better, but it is certainly an option, and it's certainly the more conventional of those options. Exosomes and stem cells are definitely considered experimental by the FDA, and that's obviously something that you want to consider. Not condoning it or pushing it or anything like that. I'm just throwing that out there for people that potentially would be interested. I think PRP is good. I've done it for years and years and basically my entire career now, 18 plus years, and I've had some good success with it in terms of pain relief for arthritis. I don't think it's overwhelmingly good, but it's certainly, if somebody's trying to avoid a surgery, I think it can be a reasonable option. What exercises? Yeah, I'm not a physical therapist, so I'm going to defer that to a physical therapist to talk about specific exercises. And again, the key, especially 7 months out, would be sport-specific exercises. So then it gets to things specific to what you need to be able to do and deficits that you have. There's not a generic program that I'd really be able to talk about. Mary, shoulder saga. Yes, we've heard lots about it. The grinding's gotten a little bit better going in for an MRI. Yeah, I hope it turns out well. I don't have an easy answer. I know you've had lots of issues. Yeah, I don't know that I'll be honest, I don't know much exosomes in terms of different types. The ones that I'm aware of, typically the facility gets them sent frozen, usually amniotic fluid, and then they thaw it before the injection. As far as is that better than other treatments, that really is something you'd want to have a one-on-one discussion with somebody that does regenerative orthopedics. 2 knee replacements, very satisfied. 1 wrist. Now looking at the other wrist. Yeah, it certainly can be good. It depends on what joint you're talking about. Exosomes, at least, are very early in studies. I know one company or lab has phase 2 level studies with the FDA for osteoarthritis. But there's just a lot of variables there. It's very early. Certainly not something that I'm gonna on social media say that people should definitely do that. But if you're trying to avoid hip or knee replacement or shoulder replacement, maybe it can be a good option for some people. And Anna Marie says, got it. Okay. Lots of good questions this week, and I hope I was able to answer that. Like I said, I can't give specific products. I don't endorse certain products or types or procedures, especially when we're talking about experimental things. With patients in my practice, I'm certainly happy to talk about that kind of stuff, but in this type of setting, it's just not possible to do that. I hope all of you have a wonderful holiday weekend next weekend, and I hope you have a wonderful weekend this weekend. Next month as well will be early because of the winter holidays, the Christmas, New Year's, all of that. So that'll be December 15th. Make sure you join for that. I really, really appreciate you being here. It means a lot to me. If you do have arthritis, you'll see a link in the channel art at the top of my YouTube channel where you can get a free copy of my ebook, The Arthritis Solution, where I talk about a lot of the different options that people try for arthritis, trying to avoid things like cortisone and surgery and things like that. So definitely check those out. Also in the description below this video, if you potentially are interested in coming to Charleston, South Carolina to see me as a patient, one of the very few triple board certified orthopedic surgeons in this country, one of 2 I think, at least when I got it, that is board certified in anti-aging and regenerative medicine. Happy to see you. There's a link in the description below where you can reach out to me and we can work on setting you up to see me in my practice in Charleston, South Carolina. No worries if not, but just know that that's out there. Hope you have a wonderful weekend, and I look forward to seeing you very, very soon. Take care.